Hello everyone, I am Dr. Purnima Pillalmari, Consultant General Physician. I am personally interested in taking lectures. So, from now onwards, I will take videos on each topic from the general medicine. Today, I am starting with the nervous system. So, what is nervous system? How it is made up of? So, nervous system, it is made up of billions of cells called neurons, and it organizes into central nervous system and peripheral nervous system. This neuron and it forms a spectacular network of connections. The central nervous system, it consists of brain and spinal cord. It is the primary center for programming and also integrating the sensory input. Peripheral nervous system, it is the one which connects the central nervous system with the rest of the body. So, how it develops? Nervous system mainly develops from the embryogenic layers, that is ectoderm. And this part of ectoderm which develops into future nervous system and sensory organs, it is known as neuroectoderm. The part of the neuroectoderm which above the notochord, it thickens to form neural plate. So here the neural plate, it forms at day 16 of the embryogenic life. Neural plate. In this neural plate, the margins of the neural plate enlarges to form neural folds. The center of the neural plate, it deepens to form neural groove. The neural folds, it come closer and gradually fuses to form a neural plate, neural tube. So, the process where the neural tube, it forms from the neural plate, it is known as neurulation. So, this neuroectoderm, it differentiates into neural tube, neural cruscles and ectodermal placodes. The neural tube, it develops into central nervous system, brain and spinal cord. The neural cruscles, it develops into dorsal root ganglia, sensory ganglia, autonomic ganglia and adrenal medulla, chromaffin tissue and melanocytes. Ectodermal placodes, it develops into cranial sensory ganglia, hypophysis and inner ear. So coming to this neural tube. This neural tube, it closes late, that in the mid and end of the 4th week of embryonic life. And this neural tube, it has two ends, the cranial and caudal end. The cranial end is called anterior neurophore and the caudal end of the neural tube is posterior neurophore. And this anterior neurophore, it closes by the mid of 4th week of embryonic life. And the caudal end of the neural tube, that is posterior neurophore, closes by the end of the 4th week of embryogenic life. So what is the importance of this neural tube? So whenever there is a defect in the closure of the cranial and caudal end, that will result in neural tube defect. And the most dangerous and which is not compatible with life is anencephaly. So the neural tube defect, it is the anencephaly. And what is the main defect here? It is the defective closure of the anterior neurophore, that is the cranial end of the neural tube, results in this anencephaly. So it is the neural tube defect and What is the reason? It is multifactorial in inheritance, that may be genetically inherited, and that may be also due to defect in the folate metabolism. That is, the patients whoever on anti-epileptic drugs, particularly valproate, which results in the folate metabolism, there is an increased chances of the formation of the anencephaly. How can we prevent this anencephaly? The reproductive age group female who are going to plan pregnancy, they have to take a preconception counseling, like who are on medication, that may be anti-epileptics or any diabetic or hypertensive drugs. They have to consult a doctor, they have to discuss like what are the medications they are using and how it affects the baby during the pregnancy. So if there is any harm to the direct fetal development, then we will change the alternative medication which is safe during pregnancy. So what are the features of this anencephaly? So this is a normal baby with fully developed brain and skull. And this is the anencephaly baby where there is a defect in the closure of the cranial end of the neural tube. So the skull wall is absent. The brain, it is present as a degenerated mass. The forebrain is absent, and here the neck, it is not fully developed. So how can we cephali baby? By measuring maternal serum alpha fetoprotein levels, and also by prenatal sonogram. And we can also prevent by providing the folate supplementation, and it is advisable to the reproductive age group female to take a folic acid supplementation 0.4 mg per day. If there is a high risk or any previous history of neural tube defect, or whether there are any anti-epileptic drugs, then we will advise to take 5 milligrams of folic acid daily supplementation, so that we can prevent the neural tube defects. Thank you.